This medication contains two important ingredients, vitamin D and folic acid. Vitamin D helps your body absorb calcium and phosphorus, which are crucial for maintaining strong bones. It is produced by the body when skin is exposed to sunlight, but certain factors like sunscreen, limited sun exposure, or dark skin can prevent getting enough vitamin D. Folic acid, on the other hand, is the synthetic form of folate, a B vitamin found in some foods. It is essential for forming healthy cells, particularly red blood cells. Low levels of folate can lead to certain types of anemia, which can be caused by various factors such as poor diet, pregnancy, alcoholism, liver disease, intestinal issues, kidney dialysis, and more. It is important for women of childbearing age to ensure they get enough folic acid through their diet or supplements to prevent birth defects in the spinal cord of infants. When taking Folixapure 5000 Unit-1 mg tablet folic acid, it's important to follow your doctor's instructions. Typically, it is taken once daily with or without food. The dosage will be determined by your medical condition and how you respond to treatment. It's important to note that certain medications, such as bile acid sequestrants like cholestyramine or cholestyramine, mineral oil, or orlistat, can reduce the absorption of vitamin D. To avoid this, it's recommended to take these medications at least 2 hours apart from your dose of vitamin D/folic acid, if possible. For the best results, take this medication regularly at the same time each day. This will help ensure that you get the most benefit from it. If your condition persists or worsens, be sure to inform your doctor. It's important to note that this medication typically has very few side effects. If you experience any unusual effects, it's important to promptly inform your doctor or pharmacist. It's also important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience any serious side effects. However, it's important to be aware that taking too much vitamin D can lead to harmful high levels of calcium. If you experience any of the following signs of high vitamin D/calcium levels, such as nausea/vomiting, constipation, loss of appetite, increased thirst, increased urination, mental/mood changes, or unusual tiredness, it's important to notify your doctor immediately. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Before taking Folixapure 5000 Unit-1 mg tablet folic acid, it's important to talk to your doctor or pharmacist if you have any allergies to vitamin D, folic acid, or other vitamin D products. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss any concerns with your pharmacist. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition from food, kidney disease, liver disease, vitamin B12 deficiency, or thyroid disease. If you are pregnant, it's important to only use doses of vitamin D greater than the recommended dietary allowance when necessary. Folic acid is safe to take during pregnancy when used as directed, but it's still important to discuss any risks and benefits with your doctor. Lastly, if you are breastfeeding, it's essential to consult your doctor before taking this medication. It's important to be aware of potential drug interactions with Folixapure 5000 Unit-1 mg tablet folic acid. Some products that may interact with this drug are phosphate binders. Vitamin D is very similar to calcitriol, so it's important to avoid medications containing calcitriol while taking vitamin D/folic acid. Additionally, this medication may interfere with certain lab tests, such as cholesterol tests, potentially causing false results. Be sure to inform your lab personnel and doctors that you are using this medication. Remember to always consult with your doctor before starting, stopping, or changing the dosage of any medications. If someone has taken too much of this medication and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember not to share this medication with anyone else. It's important to have regular lab and medical tests while taking this medication. This may include checking your calcium, magnesium, and phosphorus levels, as well as your complete blood count and levels of folate and vitamin B12. Make sure to attend all your medical and lab appointments. If you're looking to increase your intake of vitamin D, you can find it in fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. As for folate, you can find it naturally in leafy green vegetables, organ meats like liver and kidney, citrus fruits, and other foods. Folic acid is also added to enriched grain products such as bread, pasta, and cereal. When it comes to taking your Folixapure 5000 Unit-1 mg tablet folic acid, it's best to follow the recommended daily dosage and take it at the optimal timing. So, be sure to consult with your healthcare provider about the best time for you to take this medication. If you forget to take a dose of Folixapure 5000 Unit-1 mg tablet folic acid, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose. Take your next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing Folixapure 5000 Unit-1 mg tablet folic acid, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a safe place away from children and pets, and avoid keeping it in the bathroom. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, it's best to properly discard this product when it is expired or no longer needed. If you're unsure about the best way to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.